Imagine, dear aunt, the corridors of a hospital at midnight, the silence pierced only by the distant sound of wheels, the occasional beeping, the whispers of nurses. Now imagine, in these shadows, there lurks a presence darker than the mere absence of light. A figure whose hands, sworn to heal, instead deal in the currency of death. This, Aunt Florence, is the chilling narrative of Nurse Kristen Gilbert, whose story I must unfold before you today. Dear Aunt, consider the poised image of Nurse Kristen Gilbert, admired and respected, threading through the busy wards of our community hospital. Beneath her calm exterior, however, smoldered a grim secret that would soon send ripples of horror through the heart of our unsuspecting town. Kristen Heather Strickland was born on November 13, 1967, in Fall River, Massachusetts. She had a relatively unremarkable childhood, and she pursued a career in nursing, a profession that often attracts individuals with a genuine desire to help others. Kristen married Glenn Gilbert in 1988, and the couple had 2 children. Kristen began working at the VA Medical Center in Northampton in the late 1980s. Initially, she was seen as a competent and dedicated nurse. However, over time, her colleagues began to notice a disturbing pattern. During her shifts, there was a significant increase in the number of cardiac arrest incidents. The hospital staff affectionately nicknamed her Angel of Death, unaware of the sinister implications behind the moniker. As autumn gave way to the harsh winds of winter, so did more lives inexplicably fade during Kristen's shifts. Suspicion began to coalesce like frost on glass, yet proof remained elusive, obscured by her reputation and the trust she had fostered. It began, innocuously enough, with an elderly patient who passed away one cold November night. While death is no stranger to a hospital, this demise was shrouded in whispers of doubt. Kristen's calm was unnerving, her smile a little too composed for someone who had just witnessed a life slip away. The hospital, cloaked in unease, initiated a discreet inquiry. Surveillance cameras, previously benign watchers of the mundane, now scrutinized every move Gilbert made. The hospital corridors, once comforting, felt constricted, charged with silent accusation. Gilbert's method of murder involved administering lethal doses of epinephrine, a heart stimulant, to induce cardiac arrest. This would often cause the patients to experience sudden, fatal heart attacks. The increased emergency situations allowed her to be seen as a heroic figure, as she would often be the one to respond first and attempt to save the patients, thereby garnering attention and admiration from her colleagues. One night, as the moon cast eerie shadows through the hospital blinds, Gilbert was nearly caught administering an unauthorized injection. Panic flickered across her face, a stark contrast to her usual composure. The walls, it seemed, were beginning to close in. In hushed tones, nurses and doctors began sharing troubling anecdotes. the pieces of a horrifying puzzle were slowly assembling. Aunt, your past laughter shared with Christine, now echoed with a chilling resonance. Suspicion grew among her coworkers, particularly after the unusually high number of deaths during her shifts. In 1996, her colleagues reported their concerns to hospital authorities, prompting an internal investigation. The VA Medical Center then contacted the police. As the investigation unfolded, detectives discovered that several of the deaths coincided with Gilbert's shifts and that she had access to the drugs used in the murders. In addition to the deaths, they found that Gilbert had tampered with patient medications and even threatened co-workers. Cornered by evidence, Christine's facade crumbled in an interrogation room one sterile, stark morning. Her confession was a cascade of chilling admissions, each word a heavy stone sinking in the cold sea of her betrayed community. Kristen Gilbert was arrested in 1996. Her trial began in November 2000, and it lasted until March 2001. Prosecutors painted a picture of a woman who craved attention and excitement, suggesting that she created emergencies to fulfill those needs. The prosecution presented evidence that linked Gilbert to the deaths of 4 veterans and the attempted murder of 2 others. Additionally, there was testimony from hospital staff and forensic experts. The trial was a spectacle, drawing eyes and ears from across the nation. The gavel fell, and with it, the weight of justice. Christine's fate was sealed away, much like the dark secrets she had harbored. Gilbert's defense team argued that there was no direct evidence proving she administered the fatal doses and that the patients were already in poor health. Despite their efforts, the jury found her guilty of first-degree murder in 3 cases, second-degree murder in 1 case, and attempted murder in 2 cases. In March 2001, Kristen Gilbert was sentenced to 4 consecutive life terms without the possibility of parole, plus 20 years. She is currently serving her sentence at FMC Carswell, a federal prison medical facility in Fort Worth, Texas. Now, dear aunt, as you reflect upon the woman you thought you knew, consider the enigmatic nature of humanity. What prompts a healer to harm? This question haunts the now quieter halls of our local hospital. In closing, Aunt Florence, let us be reminded that sometimes the most profound darkness lies where we least expect it, hidden behind a facade of care and commitment. May we remain ever vigilant, ever questioning, not only for our safety, but for our souls. It has been a calm day around here, as management are in meetings all day today, so I could afford to have a quiet moment to write to you. Until I write again, Aunt Florence, your nurse niece Penny. Don't forget to subscribe to our channel, give a like, and comment for more content.